Okay, work me through this.
Say which of the following the most likely diagnosis? So okay, folate, iron, sickle cell, thalassemia, vitamin B12. Okay. Um, 50-year-old woman presents with tingling and numbness in her hands and feet, a gait, fatigue. She has macrocytic anemia, hypersegmented neutrophil. Further testing shows increased homocysteine, MMA levels. What is the diagnosis? Okay, so before I jump and say B12, um, one thing I know it's macrocytic, so I can eliminate iron. Um, and then when I think of macro, I'm always thinking of folate or B12.
Okay.
So, but because, and again, I know B12, but let me verify because I know B12 is involved with, yeah, B12 is involved with both pathways, but only B9 is only with homocysteine. So I'd say B12 deficiency.
Okay, good. Right. So the key thing is what? The methylmalonic acid, right?
Yeah,
That's the key. That's going to differentiate between B12 or folate, right?
right.
Okay, so going back to this question, right? Kind of let's talk about a little bit here, right? So you got all the symptoms, right? Tingling, numbness, hands, feet, unsteady gait, fatigue, right? Paresthesias, which are actually mainly in B12, paresthesias, I would say, right? And then you have macrocytic anemia, right? Hypersegmented neutrophils on blood smear, which this gives you evidence for both folate and B12. But then the most specific thing is increased homocysteine and methylmalonic acid, which is going to be increased in B12, right? Methylmalonic acid is not going to be increased in folate. But one of the things, if you kind of zoned in, let's say you didn't know that, you can still use the clinical numbness and tingling of the hand and feet, unsteady gait. Those are going to be symptoms mainly with B12.
Right.
But you get what I'm trying to say. There's more things to this question than, oh, if I didn't know the methylmalonic acid, then I would get it wrong. That's not technically correct, because if you knew the symptoms of B12 deficiency, which is that, posterior spinal cord issues, you're going to get numbness, tingling, right? Unsteady gait. That deals with B12, not folate. So anyways, just multiple ways to think about it clinically, which is what I want you to start kind of doing instead of just honing in on one thing. Does it make sense?
Yeah.
Perfect.